Okay, my name is Anne-Marie Van Cleef, and I am doing my comprehensive health exam for health assessment. Okay, I'm showing you the room now. Okay. Okay, my name is Anne-Marie, and I am going to be performing a head-to-toe assessment today. And so, if at any point you're uncomfortable, if you're in pain, please let me know, and I will stop. Can you tell me your name, please?
Sophie.
And what would you prefer to be called?
Sophie.
And what is your date of birth?
3/6/97.
And how old are you?
24.
Can you tell me where we're at right now?
Home.
And can you tell me the month and the year?
November 2021.
Okay, patient is AAO times 3. Patient appears healthy. Patient appears well nourished. She is symmetrical and her body is upright. She does not appear to be in any distress and her facial expression is relaxed. She is well groomed and clean. Her behavior is appropriate for this assessment, and her clothes are appropriate for this assessment and also for the weather. She's able to maintain eye contact and also to articulate in a conversation and able to comprehend the conversation. Can you please walk over to the wall and walk back for me? Okay, patient's gait is steady and even. She appears consistent with her age. There are no deformities, and there are no involuntary movements. Okay, can you roll up your sleeves? I'm going to assess your skin now. Okay, patient's skin is warm and dry. The color is appropriate for ethnicity. The thickness is appropriate for age. There are no lesions or edema. The body hair is evenly distributed around the body, and it's appropriate for gender. The skin is elastic, and it returns to place in less than 3 seconds. Okay, now I'm going to assess your nails. Okay, patient's nails are clean and they're smooth. There are no lesions or edema. It's the appropriate angle of 160 degrees, and there's no clubbing. The nail bed is pink, and the capillary refill is less than 3 seconds. Okay. Now I'm going to look at your head. Your head is normocephalic and it's symmetrical. There is no lesions or edema. Now I'm going to look at your hair and your scalp. Okay, scalp. There's no lesions or edema or redness or scaling. There's no flaking. Your hair is thick. It is distributed evenly over your head. It is smooth and it is shiny. Okay, now I'm going to look at your face. Your face is symmetrical. The color matches the rest of your body and it's appropriate for age. There are no lesions or edema on your face. Okay, now I'm going to look. Can you scrunch up your face like this and open again? Okay, cranial nerve 7 is intact. Okay, eyebrows are symmetrical. The hair is distributed evenly. There are no lesions or edema and no baldness. Can you close your eyelids and open them again? Okay. The eyelids, the color matches the rest of face and it's appropriate for ethnicity. There's no edema or lesions on her eyelids. Okay, her eyelashes are evenly distributed. There's no baldness. Her upper eyelashes come out and up, and her bottom eyelashes curl down and out and down. Yeah, and her eyelashes are symmetrical. Now I'm going to look at your eye. Your conjunctiva is pink and clear. Your sclera is white and clear. Your iris is green and round, and the color is distributed evenly. Okay, I'm going to turn down the light real quick. Okay, turn the light back on. Okay, the cornea is transparent and there's no opacities. The pupils are equal and round, an appropriate size, and they react to light. Now your ears, based off the conversation we've been having, cranial nerve number 8 is intact. Her ears are symmetrical and they're intact. The outer canthus of the eye aligns with the upper pinna of the ear. They match the rest. The color matches the rest of skin. There's no edema, no lesions, there's no deformities, and there's no discharge from the ears. Okay, your nose is midline. It's symmetrical. The color matches the rest of face. There's no discharge, no edema, no lesions to the nose. The lips are moist and pink. Okay, and I'm going to test your eyes now. Can you follow my finger with your eyes and do not move your head, please? Okay, all 6 cardinal fields of gaze are intact. Cranial nerves 3, 4, and 6 are intact. Okay, can you tell me when you see my hands?
No. No. No.
Okay, peripheral vision is intact. Okay, can you please hold this like 14 inches from you and cover your left eye and read the lowest line?
937826.
Okay, can you cover your right eye and do the same thing?
937826.
Can you do it with both eyes now?
937826.
Okay, vision in each eye individually is 20/25 in the left and the right eye, and bilaterally it is 20/25 together. Cranial nerve number 2 is intact. Okay, so back to the lips. The lips are moist and pink. Can you open your mouth for me? Okay, oral mucosa is moist and pink. There's no lesions or edema. There is no odor to it. The gingiva is moist and pink. There's no odor, no lesions, no edema. The teeth are white, and there's no missing teeth and no broken teeth. Can you open your mouth a little bit wider? Okay. Pharynx is pink and white and smooth. There's no edema. There are no lesions. The tonsils are rough texture. They are symmetrical. No edema, no swelling. No lesions to them. They're pink and moist. And the uvula is midline. It's smooth. It's pink and moist. No lesions, no edema. Okay, can you say ah for me? Okay, so cranial nerve 9 and 10 is intact. Can you move your tongue up and down, side to side? Okay, cranial nerve 12 is intact. The tongue is rough. It is symmetrical. It is pink and moist. There's no edema or lesions on the tongue. Okay, I'm going to look at your neck now. Okay, the neck is midline. It is symmetrical. It is smooth. There's no lesions and no edema. The trachea is midline, and there are no lumps or masses observed. Okay, the anterior thorax is appropriately shaped. There are no, the muscle development is appropriate for the anterior thorax. There's no lesions or edema on the anterior thorax. Okay, now I'm going to listen to your breath sounds, and so every time I place the diaphragm on you, can you please breathe in and out? Okay, breath sounds are clear. Bronchovascular is heard in the second and third intercostal space. Bronchial is heard over the trachea, and vascular sounds are heard over the anterior thorax. Okay, respiratory rate is 18 breaths per minute, and it is regular rhythm. Breathing is effortless with an even depth, and the chest wall expands and it falls symmetrically. Okay, can you turn and face that way for me, please? Thanks. Okay, the posterior thorax is sloped down at a 45-degree angle. The muscle development is appropriate for age, and it is symmetrical. Now I'm going to listen to your lungs, so can you please breathe in and out when I place it on your back? Okay, breath sounds are clear. Bronchovascular sounds are heard between the scapula, and vascular sounds are heard over the peripheral lung fields. Okay, now I'm going to look at your chest wall. The chest wall is rounded. There are no obvious pulsations seen. I'm going to palpate for your apical pulse. Okay, apical pulse is found in the left fifth intercostal space. You're going to listen to your heart now. Okay, S2 is heard louder than S1 in the aortic and pulmonic. S2 is equal to S1 in the Erb's point, and S1 is louder than S2 in the tricuspid and mitral area. Okay, I'm going to listen again with the bell. Okay, there are no extra sounds heard in any of the 5 places. Now I'm going to listen for the apical pulse rate. Okay, apical pulse rate is 80 beats per minute. Okay, now I'm going to look at your jugular vein, okay? So turn your head that way. Okay, and turn it the other way, please. Jugular vein is not descended and there are no pulsations seen. Okay, carotid pulses are 2+ with a regular rhythm. Brachial pulses are 2+ with a regular rhythm. Radial pulses are 2+ with a regular rhythm. Posterior tibialis pulses are 2+ with a regular rhythm. Okay, and dorsalis pedis pulses are 2+ with a regular rhythm. Okay, now I'm going to look at your abdomen, so I'm going to help you lay back, okay? Okay, is that comfortable? Okay. I'm going to look at the abdomen. The abdomen is paler than the rest of the body. There are no striae and no scars. It is flat, and It is symmetrical. Okay. I'm going to listen to all 4 quadrants now. Okay. Vowel sounds are normal active in all 4 quadrants. I'm going to lightly palpate in each quadrant now. Okay, there's no tenderness and no lumps or masses found in any 4 quadrants. And the muscle tone is appropriate and symmetrical in all 4 quadrants. Now I'm going to deeply palpate. Okay, there's no pain, no lumps or masses, and there's no aortic pulsations palpated in any of the 4 quadrants. Okay, can you sit up, please? Okay, now I'm going to, the muscles are symmetrical in all 4 extremities. The extremities are all symmetrical. All 4 of them are symmetrical. Okay, now I'm going to test your strength. Can you hold your arms like this? Okay, pull against me. Now push against me. Okay. Pull against me. Push against me. Okay. Strength in all 4 extremities are 5 out of 5. And it is appropriate for age, the strength. Okay, now I'm going to assess your ability to feel the light touch. Okay, so will you close your eyes and just tell me where you feel this? Yeah? Okay, patient is able to distinguish light touch. Now I'm going to do dull versus sharp. So I'm going to test it. That's the sharp, and this is the dull. Okay, so will you close your eyes and tell me if it's dull or sharp?
Sharp. Dull. Sharp. Dull.
Okay, patient is able to distinguish between dull and sharp pain. Okay, thank you.